Hi everyone, lovely to have you join us this evening. For those of you who don't know me, I'm Anna, and as Holly said, I'm the Head of Support Services. So just to say, please do get in touch with us at Support if there's anything we can help with at all, anything you want to talk through, but also any questions or information that you need, please do contact us. It's myself and my colleagues Catherine and Annie, and we also have Serica and Joe, who are our Midlands support officers as well. So you can get in touch with us on the support line via text message or WhatsApp. There's instant chat through our website. You can email us, and also we can arrange video calls on Skype or Zoom at a time that's convenient to you. So please, if there's anything that we can help with, please do get in touch with us. As Holly said, if you drop your questions in the chat and or in the Q&A, I'll read them out for Rhia to answer directly. I won't read out any identifying information, so I won't read out your name or any details that could identify you. So we're just protecting your privacy when we do that. Okay, well, I'm delighted to welcome Rhia, and I'll hand over to her for her talk on prehabilitation in ovarian cancer surgery.
Thank you so much, Holly, Anna, and thank you everyone who has taken the time out to join this evening. I'm just going to share my screen, start my presentation. Let me just do that now. Please let me know when you can see the screen, and I'm just going to bring up the presentation.
Yeah, we can see it, Rhia.
Lovely, excellent. So as Holly mentioned, my name is Rhia, and I've been a dietitian for about just over 5 years now, and I've been specialising in cancer for about the last year and a half. I do specifically work with upper GI, upper gastrointestinal patients, more around the esophagus and the stomach, but I do have a passion for cancers in gynecology, and I'm specifically doing some research on prehabilitation for gynecological cancers and ovarian cancer surgery. It's a pleasure to be here tonight. So today, what I thought would be nice is if we run through what prehabilitation is. It's the principles of prehab. So I may be referring to prehabilitation as prehab throughout the session, just because it's a bit easier to say. And preparing for surgery, especially in light of what you may go through if you have an ovarian debulking surgery. And then I might spend the last sort of 10 minutes talking about the work that I'm doing with my colleagues, looking specifically at prehab programs for ovarian cancer and what results are coming through from what we're seeing and actually what needs to still happen. So I thought I would start by just sharing a video. So bear with me while I just bring that up. And hopefully you'll all be able to hear this video.
I expect you're here because you, or perhaps a family member or friend, have been diagnosed with cancer and are about to have surgery or start some other form of cancer treatment. Understandably, you might be worried and feeling overwhelmed. In this video, we would like to support you by showing what you can do to prepare yourself and explaining why preparation is so important. The hospital or your healthcare team might also call this prehabilitation or prehab. Research says that when preparing for cancer surgery or other cancer treatment, you should focus on 3 lifestyle changes. 1. Eat a varied diet. 2. Be physically active. And 3. Take care of your mental health. Focusing on these 3 areas and whatever time you have before your surgery or treatment starts can help you to leave hospital earlier, reduce the risk of side effects, and feel more in control of your health. Also, if you stop smoking and cut down on alcohol, the benefits to your cancer treatment, recovery, and overall health could be even greater. We understand that following a cancer diagnosis, you might go through a period of uncertainty and anxiety, which can lead to a loss of appetite and weight. Being underweight can affect how well you cope with and recover from your treatment. And if you feel like this, try to continue eating using the advice on eating a varied diet in this video. A varied diet means eating a wide range of foods in the right proportions and drinking plenty of fluids to achieve and maintain a healthy body weight. But this doesn't mean you can't allow yourself the occasional treat. So, divide your plate at each meal like this. Each slice shows you how much of a food group should be on your plate. The amount of protein in each meal should weigh the same number of grams as half your body weight in kilograms. Protein is important to build muscle and in preparation for surgery. Also, eating a varied diet with lots of protein helps the body fight off infections and heal itself. If you're already on a special diet because of other health conditions such as diabetes, speak to your doctor, your specialist nurse, or your dietitian to get the diet advice that's specific to you. Cancer and cancer treatments are often compared to running a marathon. In the same way that it's advisable to train before running a marathon, it's important to increase your physical activity before you have surgery, radiotherapy, or chemotherapy. Research shows that you can improve your fitness and build muscle in as little as 2 weeks, so it's worth doing the prehab activities recommended even if there's only a short time before your cancer treatment. You might not have been physically active for a long time, and starting now might feel impossible, but many people who felt the same have managed to do it and feel the benefits. How much physical activity you can do and at what level differs from person to person. Aim for 2.5 hours of moderate or 1.25 hours of vigorous activity per week, as well as some strength building exercises like weight training or yoga twice a week. While it is safe to exercise when you have cancer, you need to do physical activities that are right for you. So speak to your GP or healthcare team for advice on your situation. Being physically active boosts your energy levels, helps with anxiety and depression, and reduces your risk of heart disease and type 2 diabetes. Anxiety or depression often starts at the time of diagnosis or when you're finishing treatment. You might be feeling overly worried or panicked, which are symptoms of anxiety, or you might feel low in mood and not yourself, wanting to withdraw from the world around you, which are symptoms of depression. Try to keep in mind that a big part of what you're feeling during this time is a normal response to a very stressful life experience and a way of coming to terms with it. Getting ready for treatment will help you feel prepared and stop the feelings of anxiety or depression from getting worse. If you're finding it hard to manage, make sure you get the support you need. Taking care of your mental health will improve the quality of your life long term. And research shows that for people with some pre-existing mental health conditions, making the most of that support could better your chance of overcoming certain cancers. We understand you might be going through a lot and making these lifestyle changes might sound overwhelming. But remember, everyone will have different needs and abilities, so use this video as a guide. Do what you can and be kind to yourself. Don't hesitate to ask your healthcare team for advice. They will want to help you during this time. And once treatment is over, it's important to carry on looking after yourself. So, stick with a varied diet, stay physically active, and look after your mental health. This will all help you live better in the long term.
Okay, I hope everyone found that video helpful. I thought that was a really wholesome insight into prehabilitation, into prehab, understanding why prehab is important. And in this presentation today, in this webinar, we're just going to break down what's been said in the webinar and explore in further detail the components of prehab. So what I wanted to do was to get a bit of insight from yourselves, and you could do this by popping some words or some thoughts, whatever comes to mind, in the chat. What does my diagnosis mean for me? What does your diagnosis mean for you? Some people have told me that it's a really teachable moment for them, that this is the time for them to make specific lifestyle changes as a result of a learning opportunity. And some people are very practical, taking it one day at a time. But equally, I come across people for whom a cancer diagnosis is a time of turmoil and anxiety, and they're concerned about what their diagnosis, how their diagnosis is going to impact their loved ones, and constantly sort of looking to the finishing line. And so I thought it'd be really nice if, you know, just for my benefit and for the benefit of others, if you wish to share, you know, just to really understand what, you know, your diagnosis means for you. So it doesn't have to be now, but over the course of the webinar, maybe just sort of stick some thoughts in with regards to how you felt when you first got your diagnosis in the context of preparing for your treatment. So we're just going to talk now about the actual principles of prehab. So if we were to really take a formal definition and look at this through a scientific lens, prehab enables people with cancer to prepare for treatment through promoting healthy behaviors before they go on to have their surgery or their treatment. And this is usually done by assessing the person's needs and then prescribing them a set of exercise, nutrition, or mental health and well-being interventions. I like to think of prehab in other ways. I like to think of it as a travel guide through your cancer journey. I think not only is prehab just looking after your mind and your body, but it's engaging with the right healthcare professionals to help you get through. And I think they can be vital in helping you to overcome any difficulties that you're having as part of your cancer diagnosis. It also makes you an active participant in your cancer journey. So rather than playing this passive role in your journey, prehab and doing activities to help yourself really allows you to take back that sense of control. I think prehab is about being the best version of yourself going into surgery. So being the best version of yourself physically and mentally. And sometimes it's about knowing that I'm doing everything I can and I have all the knowledge that I need and the skills and the routine to take the edge off discomfort. And very much like how the lady said on the video, you wouldn't run a marathon without training for it. So it's how you're preparing your body to go through the treatment and surgery you require for your ovarian cancer. Prehab is usually made up of three major components. Now, this might differ depending on where you have your treatment, and not all trusts have a prehab program, which is something that we'll come to talk about later on in the webinar. But usually they will concentrate on three major things. The first one is exercise, or how I like to think of it as physical activity. The second is nutrition, or eating well. The third is mental well-being. And I think the combination of these is what's important. And sometimes people think of them differently. Sometimes people think about exercise as a different category to mental well-being. But hopefully at the end of this webinar, you'll realize that actually they all work together to help you prepare. And what's really interesting now is that as programs are being developed, they're becoming better and better at recognizing who actually needs support before cancer treatment and surgery. So if you're generally sort of a fit individual who's going in for cancer treatment or surgery, you generally eat well, you possibly don't drink very much, you're not smoking, and you feel sort of well supported, you might be given a set of screening tools, maybe some questionnaires, or you might be asked by your team to stand and sit on a chair and go through a couple of tests to test your physical activity. And if overall they're not so worried about your fitness level, they might put you in a sort of universal category, where you may be given some basic information about how best to prepare yourself to be just the absolute best you can before going in. But for those who might need some extra support, you've got a targeted tier and a more specialist tier. And the people in the specialist tier are the people more likely to get referred to physiotherapists, exercise specialists, dietitians, and even psychotherapists to help them in that preparation for surgery. And I think what's really important to understand about prehab is that it doesn't actually end before you start your treatment. Prehab is very much a journey, and it very much merges into rehab or rehabilitation. So don't think of prehab and rehab as two separate things. They're just one continuous journey to hopefully get you the best you can be afterwards. And that sort of leads me to talk about the benefits of prehab. So in the scientific world and the research world out there, prehab has been researched in various tumor groups. And the most sort of prominent cancer groups that prehab has been researched in is upper GI, so the esophagus mainly, and also tumors of the pancreas. But I do having experienced working with gynecological patients, the surgery that you have to go through is life-changing, and any sort of intervention in the stomach area and in the abdomen area, requires preparation, and it requires thought. So I do feel it's very much in the category of the cancers that are already being looked at for prehab, and that's what sort of steers the research that I'm doing at the moment. So far in the literature, prehab has shown to have really positive results. The first major thing that prehab has been shown to do is actually reduce the length of stay. So after you have your surgery, the time that you spend in hospital recovering can be determined by how fit and well you are going into surgery. And the hope is that if you are fitter and healthier going into surgery, you won't have to stay as long as an inpatient afterwards, because your time for example, getting out from the bed to the chair might be quicker if you're fitter before going in for the surgery. Concentrating on your nutrition and your physical activity may help to improve cardiorespiratory fitness, which is also very important after a major surgery. Focusing on your breathing and focusing on getting your heart working and pumping is very important. It can enhance recovery following treatment, and that kind of goes in line with reducing mainly post-surgical complications. And the main thing that we think about, or the main complication we worry about in the hospital, is the possibility of getting a chest infection or getting a pneumonia, which is what they call it. And that can be quite common if you're not moving very much and you're in a hospital environment, usually surrounded by other germs. And you're not moving very much to clear the germs from your lungs. And what can happen is you can get a chest infection. But staying fit and being mobile and being well nourished prior to going in for your surgery will hopefully help to reduce that risk of catching an infection. It can, of course, improve your nutritional status if you're really concentrating on what you're eating before going in. It can improve that perspective and mental health and well-being. And it can essentially be that teachable moment where this could be the opportunity you decide to potentially stop smoking or significantly cut down on your alcohol intake. I think the most important thing which underlies all of this is that prehab has been shown to enhance your quality of life, to just make you feel happier, to make you feel that you were more in control during this otherwise really tumultuous time. So from my understanding as a dietitian of what happens with debulking surgery is that especially if you're at stages sort of 3 to 4 and the more advanced stages, your surgeon may be talking to you about, or you have already gone through what we call a total debulking surgery, which is where you can see from the left-hand side to the right-hand side, this will be removal of both ovaries, your entire womb and your cervix. So as you can see, this is a major abdominal surgery. There'll be a lot of changes to your body, and obviously there will be repercussions and consequences on your sexual health, on your health and mental well-being from the point of view of having gone through such a big surgery, and potentially the impact that it has on your gut as well. So for some cancers that are quite advanced, they could potentially impact the bowel, and that's the large colon that we see in the photo at the end there. And in some situations like that, if the surgeon has to cut part of the large bowel, what you might end up having, or if some of you may have already, is a stoma, which is essentially an external pouch from the large intestine. And that usually gets covered with what we call a colostomy bag. So there are some major consequences that obviously do come from having a debulking surgery, and going in fully armed with the knowledge and mental preparation is very important for this kind of surgery, just so that I don't think possibly anything can quite prepare you for when you come out and you're dealing with these things. But if you know that you've gone in with full knowledge and full control of how you feel, and thereafter have the tools in place to help you think about and process what you've gone through, will hopefully be really helpful. Now, for some of you who maybe don't have a total debulking surgery, or do, and maybe a stoma isn't what you're dealing with, a more sort of universal consequence of having surgery or treatment for ovarian cancer is this perpetual tiredness or fatigue that you may experience, and also pain. So pain around the tummy area is usually very common. That hopefully is something that you will have had a conversation with your healthcare team about prior to going into surgery. It may be that you you don't react well to certain pain medications, or you do know what works for you because you've had previous surgeries and you're quite in tune with your pain threshold. These kind of discussions are important to have with your healthcare team before you go in for surgery. And even once you've had surgery, if you're hit with unexpected pain, it's very, very normal. It's just about talking to your healthcare team, making sure they're aware, so that they can prescribe the right regime of pain medication for you. So now I'm just going to concentrate on the 3 major components of prehab that we focus on: physical activity, nutrition, and mental well-being. So if we start with physical activity, I prefer physical activity to exercise because I feel exercise is a word that people don't relate to as much as they do physical activity. In my mind, just looking at that strip at the bottom, sitting less and just being up for more periods of time, taking a short walk between watching the TV, sitting on your sofa, or working on your computer is a form of physical activity, is a form of staying active. Breaking up the long periods of sitting or lying down are actually what keep your muscles and your bones and your joints strong. So even if it is just a matter of making that small change of, if you're sitting down for half an hour, some Fitbits or smartwatches, and if you don't have that, that's absolutely fine. You could set yourself a reminder on your phone. You could tell your family or your peer or your colleague, look, if in the next half an hour, if you haven't seen that I've got up, please let me know and remind me. And that can be a great way to just break up the constant sitting and lying down, especially when you're feeling tired, going through potentially chemotherapy before surgery, and also the effects of the cancer as well. So think about achievable movement. Think about what's going to fit in your life and in your lifestyle. Everything counts. So every bit of movement counts. Are you, an avid gardener? Are you somebody who likes to go to the supermarket, push trolleys, carry bags? Is that what is achievable now at this stage? And if it isn't, is any element of that achievable? And whatever aspect of things that you enjoy, whether that's going for walks, whether that's going for a light jog, whether that's reining it back and maybe going for a light swim, everything counts. If I just thought I'll pull up this while I'm talking about different exercises. Thinking about being active is about keeping your heart and your mind healthy. So remember how I said that keeping your mental well-being in check is not all that different to being physically active. The two actually work very, very well together. And from the ladies who I've spoken to who are going through this process, they very much talk about how exercise is their form of mental well-being. So how often? 150 minutes a week of moderate activity. So 150 minutes a week is about 30 minutes over the course of 5 days. And that would be walking for half an hour a day, gardening, or swimming. Walking, I feel, is something that seems to be the most achievable, and it seems to be something that people naturally enjoy doing and getting outdoors. For those who don't have gardens or don't have a local swimming pool, it just seems to be an easier task. But if you have any other ideas about moderate activity that you think you achieve quite well in the week, pop it in the chat, because it might help some other people here today to see how they can increase their activity. More vigorous exercise is running, sports, or actually climbing stairs. And climbing stairs is actually a fantastic way of getting your heart pumping. And that can be in your home, that can be in your workplace. It could even be to the hospital that you're going to for treatment, rather than maybe taking the lift to the second or third floor. Possibly think about taking the stairs, just so that, before you sit down for chemotherapy or before you're going in for surgery that day, that you've done your little bit of vigorous activity. And then thinking about how you can actually build your strength, like your muscles, bones and joints. And that would be through resistance exercises and aerobics. Things like what I mentioned, people don't always go to the gym, but things like carrying bags, or something as simple as taking a tin of beans or a water bottle, something with a bit of weight, and using that to build your muscles, is a really basic technique, but it's effective. And then think about your balance, so reducing your risk of falls. So that's one thing that we do worry about after surgery is patients falling, especially our sort of older generation of patients who are a little bit more frail, possibly with some underlying conditions. Think about slower movements like Tai Chi, bowling, or, you know, just some gentle dance. And nowadays, with access to music on the computer, through YouTube, the internet, you know, anyone can sort of find things that they enjoy listening to quite easily, and hopefully just getting some rhythm and moving will help. If you feel like you really need more support with physical activity because your fitness is affected either by a pre-existing health condition, or you're just not used to physical activity, you can be referred to an exercise specialist, a physiotherapist, or even an occupational therapist to help you in your journey to becoming more independent with your movement and building your strength. So please, if you do feel that you're not able to achieve what's here on the screen today, and it just doesn't seem achievable to you, and you know that you're going in for treatment or surgery, or you're even post-surgery and you're struggling with the recovery period, please speak to your healthcare team, to your clinical nurse specialist, and they can refer you on. Macmillan have set up a really interesting program called the Move More program, and they're actually set up in different regions of the country. So it could be that a Move More program has been set up locally to you. So that's certainly worth something looking into, because there's a Move More program for lots of different areas in the country. Let's think about eating and drinking now. So we want to think about nourishing your body and taking back that control. We do focus a lot on weight loss, and we focus on poor appetite. But actually, there's a lot more that can come into play with regards to your nutrition. A lot of women might present with what we call fluid retention or ascites around their tummy area, which could be the reason why they're not able to eat as much and they've got reduced portion sizes. It could be that you're dealing with your stoma. So actually, advice around eating more fruits and vegetables isn't actually as helpful to you, because it might increase what's coming out of your stoma bag. So and for some people, you know, relying on that varied diet, which requires you to go out and possibly pick certain fruits and vegetables and greens, may be not what's practical for you, because you're tired and you're really having to rely on convenience, in which case that's not a bad thing, as long as you are understanding what you're putting into your body and what you need from the various food groups. So I have a lot of patients who rely on things like ready meals and convenience meals, because for them it means getting nutrition in without worrying about, you know, cooking something from scratch, for example. And this is where referral to a dietitian can be really helpful. If you're worried about any of these things that I've listed, or just you're not able to keep your weight up, or, you know, you're actually struggling with feeling like you're maintaining that balance, a referral to a dietitian can be really useful. And what they might help you with is educating you around what you need to change in the food groups. And it's very common for us to say, yeah, you need 40% of carbohydrates and, you know, 30% of fruit and vegetables, but actually this might change. And in the video, they spoke about protein being really important for your muscles and your joints and your recovery after surgery. But for people, for example, who have underlying kidney problems, that might not be particularly good advice. So if overall you're generally healthy with no pre-existing health conditions, having a balance of your starchy carbs and your fruits and vegetables, ensuring that you've included protein in every meal. The lady said half of your body weight, but actually a really easy way to think about how much protein you need is looking at your fist. So the size of your fist is probably the amount of protein that you should be having in one meal. So for example, that might look like a small chicken breast, or that might look like the amount of scrambled tofu or beans that you should have as part of your meal. Keeping in mind dairies and fats, these are all important as part of balancing your diet. So there's no bad food, especially when you're trying to increase your calorie intake. Sometimes you see patients who are purely on dessert diets or pudding diets, and that's actually to get their calories in. Dietitians can prescribe nourishing drinks as well, such as ensures, but also teach you how to make them yourselves. So really, sometimes nutrition is about the individual. So if you do feel you need support with getting that balance and eating well, but you're worried about how to do it safely, you can speak to a dietitian. And just thinking about convenience, you've got, every time you go to a supermarket, most foods now should be labeled with the traffic light system. And the traffic light system essentially says that if the sugar, fats or salt is red, that means it's in the high category. And if it's labeled green, that means it's sort of low, healthier levels of those individual components. So if you are relying on convenience foods and ready meals, maybe look to see ones that aren't so high in salt and aren't so high sort of in sugars and saturated fats, because what you want to do is, whilst you want to get the good calories and the protein in, you don't necessarily want to overeat on the sugar, the saturates and the salt every single day. So that might be something that you want to focus on if you are relying on convenience or buying processed food from the supermarket. And then we want to think about mental well-being. And I really like this clip art here, this image, because it just shows like a knot, almost like a ball, and how sort of it's sort of like it's being organized from what seems like a mess of thoughts. And sometimes that can be us as patients. When we're sat there, we're worried and we're anxious about what's happening to us. And this might not be the case before you have your treatment or surgery. Some of the ladies that I've spoken to actually feel more uncertain and anxious about what they've gone through after they've been through it, because when they were going through their treatment journey, and let me know in the chat if you resonate with this, when they're going through their treatment journey, they actually feel like they've got a lot going on. They've got appointments, they've got contacts with loads of people, they have the constant support of friends and family, they know they have to achieve a goal, they have to get through their treatment, and it almost keeps them going. And when it all comes to an end, that's when they look back and realize, actually, you know, what's happened, and they process everything. So really think about your mental well-being, and it doesn't have to look like any particular one thing. It can just be about effective information giving, arming yourself with knowledge. It can be having a compassionate conversation with somebody. It could be having a healthy conversation, talking about your worries or your concerns, talking about maybe what worries you other than your physical health and well-being. What else do you need to maybe achieve before you go in for treatment or surgery? And coming to terms with that and having conversations with that is a big part of self-management. So talking therapy, referral to psychotherapy is really effective. Music therapy, art therapy, aromatherapy, and like I said, staying active and maybe reducing heavily processed foods will help you feel better and more in control of your mental well-being. I do just want to make a point that about the psychotherapy, a lot of people are sort of on the fence about psychotherapy, and one of the ladies who I was speaking to kind of put it quite funnily. She said it's all a bit of woo-woo, and I do think sometimes there's a bit of this misconception around what psychotherapy actually is and what it can do for you. And you know, it's hopefully not somebody sort of sitting there hypnotizing you, but it's very much allowing you to have a non-judgmental, confidential space with a professional where you can just talk about your concerns. And this particular lady told me that actually the talking had reached a point where it was helpful and effective, but because she was more of a visual person, they started using photos as part of her therapy. So they started using visual aids and photos to help steer the discussions between her and her therapist. And she couldn't praise it enough. She just felt it was the best thing she had done. And she was very skeptical about doing it at the start. But when she did it, she was so happy that she took on the offer. So for those who are having treatment at any of these two trusts, at the Royal Marsden Hospital or St George's Hospital, there are prehabilitation programs available for you if you have ovarian cancer. Unfortunately, if you're having treatment at Imperial, where I'm based, you don't have we don't have a prehab program set up for our ovarian cancer patients. However, you can be referred to the individual specialists should you require our support. There are other ways, and they're kind of based according to region. So if you're anywhere in the Kent, Medway, Maidstone, Tunbridge Wells area, the Kent and Medway Prehab is actually a self-referral online, completely virtual prehab program where you can go on there and you just have a full list of videos, and you have a timetable where you can basically get booked into these slots with different specialists according to your needs. So you can actually self-refer, or if that's something that you're not able to do, you can ask your GP to refer you. Greater Manchester have, again, a brilliant virtual prehab service, Prehab for Cancer. And SafeFit is actually UK-wide for anybody in the UK who wants to refer themselves. They're not currently taking referrals because they're just at a bit of a threshold post-COVID, but that will soon free up. And, you know, if it's a matter of talking to somebody even after your treatment, I'm sure SafeFit are somebody who would be able to signpost you. And of course, if you don't want to go to a formal prehab program, you can always think about the online resources which are available to you. The NHS actually has a series of videos introducing sort of like Pilates exercises, HIIT. They actually have their own fitness studio exercise videos, which are fantastic. So you could just literally have to Google that, and, you know, I'll share the links, of course, with Anna and Holly so they can circulate it to you. Active Against Cancer have an online series of exercise videos, and there's even a 5K Your Way Move Against Cancer to help you sort of working towards building up to walking or possibly jogging, even 5K if that's something that seems like an unachievable target at this point. So even if your trust does not offer a prehab program, there are many resources online, and everything is becoming more virtual since the pandemic. So should you require the help, I mean, talk to your healthcare professionals in the first instance, but through reliable resources such as the NHS, Active Against Cancer, and all these various prehab programs, there are plenty of videos on there before you even go on to self-refer. So please check those out because they are useful. I'm weary of time, so I'm just going to spend literally another couple of minutes just talking about the research that I did with my group this year and what I'm hoping to do. So whilst prehab is beneficial and very important, what we don't know specifically is what prehab programs are successful for ovarian cancer patients, and actually what work is being done here in the UK. So I set out to scope out all the programs around the world for gynecological cancer. So that included everybody, vulval, cervical, endometrial, ovarian. And out of 24 studies, 12 focused on ovarian cancer. And actually, there were some really promising trials that are coming up in ovarian cancer, about 4 to 6 trials alone. Unfortunately, none of them are in the UK, but some of them are based in Europe and a lot are based in America. We don't have the results of those trials now, but we're hoping by 2024, we should have the results of these trials. So we'll really know what seems to work for our ovarian cancer patients. And what's interesting is that all these prehab programs are different. Some of them are using health tech, some of them are using fit watches, and some of them are using technology so that you're purely in remote contact with your healthcare team. So we are moving into a very virtual space, which I think is beneficial for some, but it might not be as beneficial for others. And we were really able to group what seemed to sort of affect whether women engaged with prehab or not. And we grouped it into patient motivation. So are you motivated to get up and prepare and do things in preparation for treatment and surgery? What role are your healthcare professionals playing? Are they actively encouraging you, motivating you in this process? Is prehab even acceptable to you? You know, are you worried about other things? What are your concerns? Is prehab even a priority? And also access to prehab. Yes, virtual is fantastic, but what about those people who don't have access to these kind of, the technology that we have set up today, for example, and they're quite reliant on that face-to-face interaction? So I actually set out to do that research myself. And I collected 21 participants between Imperial College and the Royal Marsden. They were either stage 3 or 4 ovarian cancer patients, pre or post surgery. And the Marsden patients actually had experience of prehab as part of their MAR program. They were demographically diverse, which is what no other study has looked at, because all other studies have mainly focused on white populations. So it was demographically diverse across age, ethnicity, and occupation. And I was essentially just asking women about, their priorities and preparation for surgery, people like yourselves who have going for surgery and have had surgery. And what did I find? I found that the role of friends and family are crucial to preparation and support. Let me know what you think in the chat. Do you agree? Do you agree with the findings of this study? That actually physical preparation mostly was rated more important than nutrition or psychological preparation. Really interestingly, a lot of people felt that they were psychologically prepared, mentally prepared, if they had a good support network around them. So people who had a big family circle and lots of friends felt that that was all the support that they needed. Let me know what you think about that as well, because people who went on to do psychotherapy were able to distinguish between the two, but people who hadn't gone on to have psychotherapy felt that actually all they needed were their friends and family. So let me know what you think about that point. Remote is accessible. Yes, it's easy to access, but actually face-to-face is preferred. People still love to have that human contact, and definitely being able to see somebody's face and having a live conversation is preferred compared to being completely remote or over the telephone. And one fantastic theme, which I just found, I interviewed 21 women, fantastic women, strong, capable, independent women, all from different walks of life. And they all said that staying positive was the fundamental coping technique. And this just ran through as a theme across the board. So, tell me in the chat, maybe put something in there about, do you think this is sort of specific to being a woman? Are we able to cope with things in a different way? Is our perspective of coping different? And what's important about staying positive? And anything else you can put in the chat. Do you think prehab is important in preparing yourself for surgery and treatment? Are you resonating with anything that was said today in terms of nutrition, in terms of physical activity, mental well-being? And which aspect is a priority for you? Do you think being fitter and more physically active is more important than eating well? What else do you consider a priority in the lead up to surgery? Some people talk about getting their legal affairs in order. Some people talk about settling their families. Some people talk about just doing a house clear out and getting all their domestic tasks in order. So when they come back from surgery, their house is clean. And actually they'd rather do that than focus on themselves. And can you think of any barriers to taking part in prehab? Specifically, other than maybe time? So I know time is a big issue for a lot of people, 2 weeks, but as it was said in the video, even 2 weeks is enough time to prepare yourself for surgery and for treatment and to really go in the best version of yourself. So that is everything that I had to sort of present to you today. I do hope that you found this webinar useful. Please put your thoughts in the chat. Hopefully, we can spend the next 10 minutes being as interactive as possible. So yes, I'll just hand over to Anna.
Thank you so much, Rhia. So we've had plenty of comments and some questions come in, and just to let people know as well, Rhia did kindly offer that any questions we don't have time to get to before we finish at 7, she is happy for us to email them to her and we can circulate the answers to the attendees afterwards. So in terms of your question around those feelings when you're first diagnosed and preparing for surgery, people have said it's a time of uncertainty and worry about the impact on family, but they take each day at a time and try and find positives in everything that happens. Somebody else said that having a rare ovarian cancer has made them feel alone. Someone else has made a really interesting comment, I think, about whether there's ever a finishing line, really, and you spoke about prehab leading into rehab and things, but whether there's ever that sense that there's any finishing line there. Then later on in the talk, when you're talking about after treatment, someone said they totally agree, and especially around the psychological impact, that someone said they totally agree that it's hardest after treatment. Someone has said that they found neuro-linguistic programming very useful to help control the head noise and the relaxation techniques. And someone else has said that they found that the learning at diagnosis it felt like being hit by a high-speed train, as there was so much to understand. When they had recurrence, they could draw on what helped in the first occurrence and then build more knowledge to help their diet and mental well-being. Enjoying walking gently and getting more active continues to help shift their mood positively. And someone else also commented that prior experience of big debulking surgeries definitely helped me cope with my last surgery in May, knowing what to expect, what the pain levels would be like, limitations in movement, etc. I was also generally fitter and healthier, so I'd already taken on prehab without realising. Someone else has said that their GP's guidance was to eat well, exercise well and rest well. He knew me well enough to know I'd find the rest the hardest for me. So that was exactly what you're saying, Rhia. And that I had to practice ways of resting well. I found arranging Skype calls with positive friends, reading, listening to podcasts, teaching myself to knit and weave have become part of my days. And then we did have a question as well. Was there anything you wanted to pick up on from those comments, Rhia? And then I'll come to some of the questions.
Yeah, no, I mean, I just want to thank you all for being so open and honest with your comments. I have had such a fabulous opportunity to speak to women just like yourselves. Actually, each interview lasted up to an hour long. So we really went into a lot of detail about preparing for surgery and, you know, what worked for women, what didn't, the emotional sort of journey that they went through. And you know, this is all just adding to that wealth of information. And it just goes to show that whilst prehab is important, you know, there are so many things that we need to consider, like that feeling of like feeling alone just because of the type of diagnosis that you have. But then also people actually doing prehab without realizing it, because there is this sense of like, you know, wanting to better yourself and go in really well prepared. And I do think that, you know, whoever mentioned, I think it was the point about your doctor knowing that your doctor knows that you can't rest well. Oh my gosh, it was such a common theme coming through in these interviews, where you had ladies who were concerned about not resting well because they had to look after their young kids, all the way to ladies who were carers for their husbands and worried about the meals that they had to prepare in the fridge for him in order so that she could go to surgery, you know, without any worry in her mind. So I feel like, you know, we as women, we've got a lot more to think about usually than just ourselves. But what prehab really does is it really helps you to bring it back to yourself, that actually this is your time, it's time for you, it is time for everybody else as well, but enriching yourself with the experiences that make you feel you're the best version of yourself is what's really important. And I think somebody mentioned actually, you know, the bit afterwards, that's when it really hits you. And it's so true. Like, people think about going through it, and actually you're going through it with the support of everybody. You're on a bit of an adrenaline, and then you reach the end and you look back and think, oh my God, I went through all of that. So a lot of people spoke about the processing afterwards. Exactly, is there ever a finish line? Because you need that time to reflect as well. And that might be when you need to look after your body, consider your mental well-being, and eat well, and take control back, is all when it's finished, because or finishing or nearing the end of that formal treatment. But your journey stays with you for life. So one thing I did ask the group as well when I was interviewing them was, what are your thoughts on networking, doing what we're doing today, talking to other people who have been through the same journey as you, sharing ideas? And it's really interesting because it was so pulled. Half of the women said that they would be happy to do a group session. They'd be happy to network and have a coffee and share stories about their cancer journey and their diagnosis. And the other half were quite certain that that's something that they wouldn't want to do, that actually they didn't want to necessarily have that negativity in their process through the cancer journey. They wouldn't want to hear about somebody who was having a worse off time, or even somebody who was having a better time, because it would make their time feel worse. So it just goes to show that people do cope very differently with things, even though the themes and the threads are very similar. What works for one woman might not work for another. And that's why building a formal prehab model or a program is difficult, because we're not all the same, even though we may come across with the same needs. How it's delivered is what's going to be a challenge.
Thank you, Rhia. Someone asked, to clarify on the pain post-surgery, and that is pain a common side effect that you can be left with?
Thank you for that question. I actually might put this question back to the group for anybody who has been through surgery themselves, anyone who has had experience of, actually experiencing pain after surgery. I don't know if anyone can help with that question. I think what I was saying specifically is that pain after surgery is common because of the sheer amount of manipulation that goes on in your body. So pain is expected afterwards, especially when you're restarting mobility. So what's important is to really understand that there are people there to help you with your pain management, and pain management should be a very sort of seamless part of your recovery afterwards. And there should be open conversations about your pain management, how you're feeling, and making sure that you're keeping on top of the pain, because it's really hard to get back to your mobility, feeling like yourself, and wanting to move on with life and getting back to normality if you're feeling in pain. So, pain is one of those, pain and tiredness are those things that really hold us back. So please have open conversations with your healthcare team that's what you're struggling with, if you are, and they can help to, either themselves or getting involved with the pain management team to help you with that afterwards, I think is really important. Hopefully that answers your question, but I don't know if anyone else has anything to add to how they manage their pain afterwards.
Thank you, Rhia. We're nearly out of time, but I just want to thank everybody. Oh, someone has just regarding the pain question, someone said they initially had a morphine pump, but after a few days didn't have much pain. Some people have made some really useful and helpful comments, and we will pass all of those on to Rhia. And as Rhia said, thank you for your honesty and openness around your experiences. We've not had time to come to them all, but we will absolutely make sure that Rhia has them all, so that she's got that feedback and all of your valuable insights into your experiences. So thank you very much to everyone who shared those, and I'm sorry that we've not been able to have the time for Rhia to discuss them now. But thank you very much for all your contributions. Also, some of you have recommended certain services and things that have helped you, and thank you ever so much for sharing those, and we'll circulate those to everybody in an email afterwards, including the contact details for the support service, but also our events, which include yoga and exercise sessions as well. So we'll circulate all of those and your recommendations for the different services. too. So thank you everyone for sharing all of your insight, all of the support and all the information, and we really appreciate it. And I'll ask Rhia if there's anything you want to say before we finish, Rhia.
I just wanted to thank you, Anna and Holly, and all of the participants today and attendees. I mean, it's a shame that I can't see everyone's faces because it's so lovely to sort of interact with everybody. But I hope that you found this useful. From the comments I can see in the chat, I think, you know, hopefully it went down okay, and you sort of got the information or the inspiration that you needed to believe that prehab is beneficial. Hopefully we continue to do more work in this area and really have some positive research, answers and studies that are reliable, so that, you know, big trusts can go on to actually formalize these programs, because at the moment most of them are running as trials. So the problem is, without data we don't get the money to do these, so it works hand in hand. So hopefully we can continue to do good work and continue kind of educating all of our patient groups, and you're all a form of education for each other as well, because you're the people who have experienced it. You know, the real life first-hand experience is always invaluable. So please keep talking, please keep sharing. The more people you can help, you know, the better and easier it will be for an individual to go through this journey.